I'm Dr. Sandhya Rani. I'm a senior consultant in obstetrics and gynecology department, Aster and Women and Children Hospital, Bangalore. So today I would like to discuss about cervical cancer vaccine. So as we all know, February is celebrated as National Cancer Awareness Month. So as a part of this initiative, I thought I would speak about cervical cancer vaccine. Now what is cervix? And why are we so worried about the cervical cancer? So cervical cancer is one of the most common cancers in women, and India contributes about 1/4 of the total number of cervical cancers in the world. So why is it so common in India? Maybe because the rate of screening is very less. The awareness about cervical cancer is very less. Now what is it? So cervix is the opening of the uterus. It is also called the mouth of the womb. Okay, so this is easily visualized by a gentle physical examination. So what are the causes of cervical cancer? The most common reason or cause for cervical cancer is an infection by a virus called HPV virus, that is the human papilloma virus. So how does this virus reach the cervix? So once women become sexually active by close contact, so the virus transmits from person to person. These cells find their way to the cells of the cervix. This virus finds its way to the cells of the cervix. It lodges itself in the cervical cells for many years. So do all the women who have this virus develop cancer? No. There are certain patient-related factors as well. So who are at risk of developing cervical cancer? So any woman who has this virus called HPV virus and also has one of the risk factors, like probably she has started her sexual activity a little early on in her life, or somebody who has multiple sexual partners, or their spouse has multiple sexual partners. Women who smoke are at more risk of developing cervical cancer. And women with low immunity, like those belonging to the lower socioeconomic status, or those who are anemic, those who are on long-term treatment with steroids, which reduces their immunity, and those women who are also affected with HIV have less immunity, and in turn their risk of developing cervical cancer increases. So how can we suspect, or when should you reach out to the doctors to see if you have cervical cancer or not? So the symptoms of cervical cancer usually start a little late, but they present as some kind of bleeding. So usually it presents as a menstrual bleed which is heavier than usual, or it could be a menstrual bleed which is lasting for a little longer than usual. Intermenstrual bleeding, that is bleeding in between two normal periods, and most importantly postcoital bleeding, that is bleeding after having a sexual intercourse, because the cells are there and when the intercourse happens they get disturbed and they start bleeding. The other symptoms can be very painful intercourse because of this cervical cancer cells being there. Sometimes the nerves get involved and they can start off as pain during intercourse. So if any of these symptoms are there, it is the time for you to reach to the gynecologist and get yourself tested. What are the other instances? Honestly, cervical cancer is the only cancer where there is an effective screening test. Screening test means a test which can be performed to all women irrespective of whether they have the symptoms or not, and catch the problem at an early stage where it can be treated easily without needing to go for any advanced treatments. So what is that screening test that we have for cervical cancer? It is called pap smear. So all of you would have heard of pap smear. So it is a simple diagnostic test done in the OPD when you visit your gynecologist. There's a small spatula kind of thing. So we take a help of a brush or a spatula and collect a few cells from the cervix. And those cells are either put on a slide or put in a liquid and sent to the pathologist for identification of abnormal cells. Depending on the level of abnormality, it is classified as precancerous or early cancer or advanced cancer. And the treatment and the follow-up will depend upon the degree of abnormality identified in the pap smear. So Once women start undergoing these regular pap smears, it becomes easy for the healthcare professional to pick up those women who are at high risk for developing cancer or where the abnormalities are already there. And then we can start treating them. So we do have a few questions in between. So I'll take this question first. How early onset of sexual life can cause cancer? So early onset of sexual life increases the duration of exposure of the woman to the virus. Suppose a woman becomes sexually active at 18 or 19 years. That means she is exposed to the virus from 18 years of age till throughout her lifetime. Compared to a woman who starts her sexual life at 26, 27, there the number of years of exposure are less. So this extra years of exposure and that early age where her immunity is not probably fully developed or matured increases the risk of cervical cancer. Can you name those steroids which cause cancer? They are not specific steroids. There are a lot of health issues like somebody who has a kidney issue or some rheumatological problem where low dose steroids form the basis of the treatment and they are given for a long time. Any steroid when used for a long time or when given in a high dose reduces the immunity temporarily. That is when they become more susceptible to the infections, be it viral or bacterial infections. The prolonged usage of steroids or high dosage of steroid causes. Why don't doctors do screening for steroid causing cancer? Dr. Santosh, Mr. Santosh Kumar, so whenever a woman is put on steroids, they are usually counseled about the long-term effects or side effects or whatever extra precautions are needed for the duration at which the woman is taking the steroid. So the physician prescribing usually counsel them of all the side effects before putting anyone on the steroids. Steroids in adult vaccine can cause cancer. I'm sorry, I didn't understand this question, but okay, steroids are basically immunosuppressants. Steroids, they work in a different way. A side effect of them is immunosuppression. Yes, they help in the treatment of the primary disease to a little extent by reducing the immunity, but there are many other mechanisms by which they work and help the woman out. So it is not that steroids are really bad for humans or you should go really against it. When indicated, like somebody has a kidney disease or a rheumatological disease or any other problem where steroid is the main course of treatment, we see the benefit versus risk. So if the benefit of giving the steroid is much more than the small risk of side effects. So, and I'm not talking of maybe a 1 week or a 2 week course of steroid causing cancer. I'm talking of long term, maybe 3 years, 4 years and all. Okay. And if you have any more doubts, you can contact us personally. I'll probably talk to you a little more in detail. This is not a forum for a detailed discussion of steroid because I'm here to talk about the cervical cancer vaccine. So after we are talking about the pap smear. So who has to go for a pap smear? Any woman who is sexually active should be going for a pap smear. As per the international guidelines, they said it should start at least 21 years of age. It can be started as per Indian guidelines, they say 25, but logically any woman who is sexually active should be going to her gynecologist for pap smear. Now, how often should they get this done? So, pap smear should be done once in 3 years, okay? And if at all there is something called co-testing, that is along with the pap smear, that is along with the study of the cells, the HPV virus is also tested for, that is called co-testing. Then once in 5 years. Till when should women go for this pap smear? Till she is about 60 to 65 years of age, this screening is helpful. So once we do these regular screenings, probably the deviations can be picked up a little early and the number of advanced cancers can be reduced and the treatment can be initiated early on. So after the pap smear, now coming to the topic, the most important way of preventing cervical cancer is through the vaccine. So since it is a virus which is causing the infection and a long-term transition to cancerous cells, this vaccine is directed against the virus. Now who can take this cervical cancer vaccine? As per the current guidelines, any person above 9 years, so it is mainly targeted towards the younger age group before they are sexually active, and at that age group the immunity response is better. So any child above 9 years of age can take the vaccine. What is the maximum age group? Usually the cutoff is 45 years, because beyond that going for regular pap smears is much more beneficial than taking a vaccine. It takes long for the immunity to develop. So how many doses? So it depends upon the age group that the first dose of vaccine is initiated. So if the vaccine is given to children, both girls and boys of age group 9 to 14, that is before their 15th birthday, 2 doses of cervical cancer vaccine or HPV vaccine is enough. So first dose is given, and 5 to 6 months from there the second dose of the vaccine is given. It is given as an injection form. Suppose there is a child between 9 to 14 years of age group, but they have low immunity due to some other condition or health problem, then they will require 3 doses of the vaccination to improve their immunity response. So can girls above 15 years take it? Yes. Between 15 to 26 years also the vaccine is highly recommended, and for them 3 doses of the vaccine has to be given. The first dose is given, and 2 months from there the second dose is given, and 6 months from the first dose. So it is 0, 2 and 6 months. So 3 doses are given over 6 months for all the children between 15 to 26 years of age group. So there may be the question that I am about 26 years and I missed out the vaccine. Now what am I to do? So women between 26 to 45 can also opt for the cervical cancer vaccine, but the efficiency of the vaccine probably will be a little lesser than what it is for women or girls who take it a little early on. So the dosage is the same, 3 doses over 6 months, 0, 2 and 6. And in spite of taking the cervical cancer vaccine, the regular pap smears have to be continued for women who are about 26 years of age. So you may ask me, what is the benefit of taking the vaccine if I have to go for regular pap smears? So the concept is that suppose you already have a particular strain of HPV vaccine. There are over 100 strains of HPV virus identified in the world. Amongst that, there are 2 most common causes for cervical cancer, that is strain 16 and 18. There are a few more strains which cause not only cervical cancer, vaginal cancer, warts and all, and there are the other strains which are harmless. So when you take the vaccine, you get protection from these major strains which are most commonly linked to the causation of cervical cancer. So if a woman is sexually active, she has a particular strain of HPV in her body. The vaccine may give her protection from the other strains of HPV virus, and regular pap smear will ensure or observe the changes brought about by this particular strain. So for women above 26 years, it is mandatory for them to both take the vaccine and go for regular pap smear. So who should not take this vaccine? So women who are pregnant are not supposed to take the vaccine. However, if a woman takes the vaccine and in 10 or 15 days she realizes that she has conceived, it would do no harm. She will just withhold the further doses and finish the course after she delivers. Breastfeeding women can take the cervical cancer vaccine. In fact, it is the ideal time for us to talk about it and initiate, because post-delivery they are eligible for the vaccine and they will be ready to listen in case they have missed out on it pre-pregnancy. Then women who have had allergies to any previous vaccinations are also given the vaccine with a caution, probably in a setup where all the anti-allergic medicines are kept in hand, and if they had severe allergic reaction, then this vaccine is a big no to them. So anyone with a lowered immunity like HIV patients or women on other immunosuppressants should be taking 3 doses of the vaccine and going forward with the regular screening as well. So are there any side effects of this cervical cancer vaccine? Minor side effects like pain at the injection site, a little bit of swelling by the next day are commonly seen. Beyond that, it is the fear of an injection which may cause giddiness rarely. Other than that, there are no noted or significant side effects of this cervical cancer vaccine. And how does this vaccine work? Like I said, it triggers the immunity of the body to fight against the viral particles or the viral cells. So to summarize, cervical cancer vaccine is a very effective method or way to prevent the number of cervical cancer cases, especially in a country like India where we are contributing almost 1/4 of the total cases in the world, taking the vaccine early on. So all the women out there, please take the vaccine, and if you have children who are above 9 years of age, make sure that they get the vaccine. Recently, there has been this 9 strain vaccine. Earlier, when these vaccines were developed, they were effective only against 2 strains. Then came the quadrivalent vaccine, which was effective against 4 strains of HPV. Now the nanovalent vaccine is available, which gives protection from all the major and few of the minor strains also. It protects women and children from not only cervical cancer, the vaginal cancer, vulval cancer, the warts, all the skin related issues which can be triggered by this HPV vaccine. Please do not have any doubts or fears in taking the vaccine, and in case you need a little more information, reach out to your gynec who will explain to you about this vaccine and the pap smear. Together we can fight against this cervical cancer. Thank you.